As the NASCAR world mourns the loss of driver Kyle Busch, many are left wondering how he could have died so suddenly. Busch died last week at the age of 41, days before he was set to compete in a race in North Carolina. His family said he'd complained of a substantial cough in recent weeks and he died of pneumonia-induced sepsis. And joining us now to talk about sepsis is Dr. Balestra, who specializes in pulmonary and critical care medicine at the Oregon Clinic. Dr. Balestra, thanks a lot for joining us. We appreciate it.
My pleasure.
So to start, Kyle Busch was only 41 years old, an athlete in presumably good shape. How could he have gotten so sick so quickly?
What happened to him is very unusual in young, healthy people, but infections sometimes can trigger an overwhelming response that can lead to organ failure, and sometimes we can't really understand why that happens. We know that people with underlying health issues, heart and lung issues, or immunosuppressive conditions like transplant recipients or diabetics can potentially be at increased risk. But we do sometimes, unfortunately, see younger people who are otherwise healthy who can have a very overwhelming response to a bacterial infection and have a bad outcome.
So how common is sepsis and who's most at risk?
Sepsis is very common in general, especially for those of us who work in the ICU. Most commonly at risk are people at the extremes of life, so newborns and elderly people, and everybody who has an immunosuppressive condition, such as transplant recipients, diabetics, people who take immunosuppressive medications, and then everybody with chronic health conditions, especially heart and lung conditions, can be at increased risk.
How often is it maybe somebody has a cut or abrasion on their skin? I know I lost a good friend who died after that was his start with sepsis.
It can be, especially if with certain types of bacteria that can be very aggressive. Sometimes skin infection can progress to become overwhelming, especially if there are delays in care or if there's a pocket of fluid that needs to be drained and isn't. Those things can sometimes make things worse.
Yeah. Well, for Kyle Busch, that wasn't the case, but could his death have been prevented if treatment was administered sooner?
It's hard to say. Sometimes the infection is so overwhelming and the response to it even worse that that even with early treatment, things can still go badly. Certainly, it's very important in the case of any infection, and especially when it's a severe infection leading to sepsis, that treatment not be delayed and that treatment be instituted early on to maximize good outcomes.
Sure, it makes sense. So the takeaway for our viewers, for folks watching us at home, what can they do to minimize their own risk?
Well, general healthy lifestyles, exercising, eating well, receiving all the appropriate immunizations and vaccines that are recommended for your age and risk group. Those things can help prevent severe infections.
Well, Dr. Balestra from the Oregon Clinic, thanks so much for your work and for joining us today. Appreciate it.
Thanks for having me.